How's it going, everyone? This is Taylor Lewis with the Pulmonary Performance Institute. And today what I want to talk to you about is kind of the scapula, the shoulder blade, the bone that sits on the rib cage on your posterior side of your back. And one thing I want to talk about today is just the placement of it and the function of it. And the reason why is oftentimes with some of our clients we see a shoulder blade that's not sitting in the right position or set in the right position to allow proper function to happen. And sometimes that's because stiff rib cage, tension in the neck, stress. There's multiple different variables that can occur, but first we need to understand this placement and how it really affects the arms and rib cage function and even shoulder blade function. So one thing we want to think about first is understanding what movements it does. So I've listed here is your shoulder blade protracts, which means it moves forward, and then it retracts and pinches back, okay? And then elevation and depression. So we have a shoulder blade here, and bear with me because this is not the best picture when we talk about things, but what happens is your shoulder blade goes up and then it goes down. So think as if the back of someone's skull is right here. So it's gonna go up and then it's gonna go down. Another thing it does is it upwardly rotates, so it rotates around your rib cage and then it pulls back down. And that happens a lot when we're raising our arms overhead. And then last but not least, your shoulder blades tips forward, what we call anterior tilt or posteriorly tilt based on what you're trying to accomplish. Now, one thing to think about is the rhythm with the shoulder blade and the arm. So what research has showed us is as your arm starts to elevate, now there's a lag time of around 30 degrees, which means as the arm starts to get above, the shoulder blade doesn't necessarily move, but as it starts to raise, what happens is there's a give or take a 2-1 ratio, which means is when my arm raises 2 degrees up, that shoulder blade is gonna rotate, or what we call upwardly rotate, to allow movement to occur and allow you to get the mobility, right? So this is that 2-1 ratio. Well, what we have to think about here is since this shoulder blade sits about 30 to 45 degrees on the rib cage in the transverse plane, which is kind of tilted around the rib cage here, okay? So it's not perfectly right in line with the rib cage. There's a slight tilt there. Now, what happens is we have muscles that connect the top from the neck all the way down to the top of the shoulder blade. We have muscles that connect all the way from the bottom of the shoulder blade down towards the thoracic spine or the lower back. And we have muscles that connect more of the medial border and the inside. We also have muscles on the inside of that shoulder blade that wrap around the rib cage, that serratus muscle, that all affect this. So we have muscles that connect from the neck all the way down to the lower back. So your whole spine position can be affected by the placement of your shoulder. Now, when you have ventilation or respiratory difficulties or breathing, your ribs that should expand out and then tilt up. If they're tight, this is going to change the position of the shoulder blade, and we can get some tightness in the neck. Right here, we can get some discomfort in the lower traps and sometimes some stiffness in the middle. And when that sits that shoulder blade differently, when you go to raise your arm overhead, what's going to happen is you're going to start to feel maybe some impingement there, your range of motion can be affected, and not only where the rib cage is, but think of your spine position. If you're more of a kyphosis or kyphotic person with a rounded back, that is going to change your position on the scapula on the rib cage, because remember, this scapula sits right on that rib cage, okay? So if my spine is rounded a little bit more, then the positioning's going to change. Now, if the positioning changes, this 2-to-1 ratio changes. It's like someone starting on a starting line 5 feet in front of you, right? They're going to start differently than the person behind them, and same idea. So if I start to raise my arm overhead and that shoulder blade is not set in the right position, then that's going to change the whole rhythm of my movement of trying to get my arm to raise overhead. So what I want to do is I'm going to take you through 3 exercises, very simple exercises to do to help with the rhythm of your shoulder blade on the rib cage. Now once again, think about Ideally, you want to get the proper person like a physical therapist or exercise physiologist or someone that specializes in shoulders to really see the position of your shoulder blades to give you more specific exercises. However, sometimes we can't do that right away. So I want to show you 3 exercises that you can do that's going to help kind of get a better rhythm of your shoulder blades so you can potentially reduce neck stiffness, some impingements in the shoulders, or just free them up to allow them to rotate around the rib cage as much as you can. Because remember, we want to be able to protract and retract our shoulder blades with proper form and synchronization. We want to be able to elevate our shoulder blades as our arms go overhead, upwardly rotate, and we want that scapula really rotate around the rib cage. So as my arm goes overhead, I want my shoulder blade to rotate over the rib cage, let my serratus pull it and allow me that range of motion. And then of course, we want to be able to tilt anteriorly and posteriorly our shoulder blade in the proper position. Because one thing to think about is when my arm starts to get overhead, if I don't tilt my shoulder blade back, I'm going to start to feel some limitations here. And so we want to make sure that flows very easily around the rib cage. So here are a couple exercises that can help you with that. The first exercise I want to talk about through our 3 exercises for kind of greasing the grooves for the shoulder blade to help with positioning and kind of rhythm is an exercise could be similar to some is cat-cows. And what's good about a cat-cow is like I talked about, when your shoulder blade sits on the rib cage, well, your ribs are connected to those spine segments. So if you have that kind of kyphosis or kyphotic situation, that's going to change the position of the scapula on the rib cage. Okay, so what we want to first do is start by targeting the spine. Okay, so we need to open up the spine, get some good flexion and extension, and that's going to allow the scapula some room to then improve where it sits. So what I want to think about with this exercise is we're going to really focus kind of that thoracic spine area in the middle. I want to try and limit how much I use my cervical spine or the neck. One reason why, once again, is when you may be a little bit more rounded, your cervical spine is going to drive you up a little bit. So there could be a little bit more range, or there is a more range of motion in that neck. So we want to really target kind of the middle of that upper back. So in the quadruped position, I want to go hands slightly outside of shoulders. So just like we talked about, we want our hands slightly outside of shoulders. We don't want them stacked in because the positioning of our humerus within our shoulder blade is a little outside of our shoulders position, okay? Now from here, I just want to think about focusing the sternum driving the movement into extension. So what I'm going to do is I'm going to first round and tuck my rib cage as much as I can, getting that good flexion. Then I'm going to think about pulling down through my palms. So I'm going to try and pull down through my palms, drive my sternum up while looking straight ahead. So I don't want to look to the sky, okay? Because if I'm rounded and stuck, then all of a sudden I'm going to jam my neck a little bit here. So I'm going to really drive my sternum or the logo of my shirt up, pull my shoulder blades down, then slowly, one vertebrae at a time, try and round. And then same thing, pull through the palms down, one vertebrae at a time, driving my sternum up, really getting good extension. And then really targeting the flexion and extension of my spine. And what you'll see in this position, as I'm rounding and as I'm retracting, you're also working the shoulder blades. Because once again, if your spine moves, there's a good chance it's going to play some type of effect on the shoulder blades. But you got to really think about sternum, logo of the chest versus trying to look up, because then I start to crank into my neck. So think with the cat-cows, one vertebrae at a time, slowly extending and then slowly rounding to loosen up that spine. Now, If you are a little bit more hypermobile or you have that full range, you want to make sure that you don't go to in ranges, which means if I was super mobile, I'd keep rounding, and I'd have this massive hump. You want to stay within a range there, okay? Now I'm a little bit stiffer, so I can't really show you that full optimal range, but if you start to feel any pain or discomfort in your elbows, any shoulders, any spine, then you want to kind of pull back and live within your means there. So cat-cows is a great starting exercise to get better movement rhythm of the spine into flexion and extension, especially if you have this kind of kyphotic type position. But then what it's going to do is, since that loosens up, it's going to set things a little bit better that will help transition us to the next exercise. The next exercise that we're going to do is the standing scapular retractions with your elbows on the wall. What's good about this exercise, once again, when we talked about the different movements of the scapula, this works the protraction and retraction of the scapula around the rib cage, which is key because, like we discussed earlier, is if your scapula is sitting differently or not in the right position or optimal position, when you go to move your arm overhead, there could be some impingement, reduced range of motion, some discomfort, or even some stiffness. So what this exercise does is kind of grease the grooves and allows the scapula to rotate around the rib cage, which is a key component when we start to raise our arms overhead. Now what you want to think about doing is, we're going to be in a position where our elbows are slightly outside of the shoulders. The reason why is, once again, your scapula works with your humerus, and we want to set it up in the proper position. So if we're too close, that shoulder blade position or the humerus position within the scapula is not going to be optimal. So we're going to pull our arms slightly outside of our shoulders. Okay? From this position, we're going to bring our elbows fairly in line. When we're talking about height when it comes to the shoulder blades, we want to stand tall and think this is a subtle movement, okay? So I want to keep my center of mass going straight down through my body, so I don't want to lean forward or push too far back. I'm going to try and pinch my shoulder blades together, and when I pinch my shoulder blades, I'm thinking middle to lower portions of my shoulder blades, okay? We don't want to get the upper position here. I'm going to pinch my shoulder blades together, and then I'm going to push my forearms into the wall, tuck my rib cage round, and then pinch the shoulder blades together, and then push back around. So all I'm doing is trying to pinch or pull the shoulder blades together, and then tuck the rib cage and round. And that's where the serratus is going to help start to rotate. Now, like I said, you want to make sure that you're not pinching the upper half. So if you have any neck stiffness or tightness when you're doing this exercise, it's probably because you're trying to either shrug and pinch, or we're just not getting that lower half. So think of kind of a low pinch, and then round and repeat. The key with this exercise is a subtle movement of moving back and forth. And this is going to help try and grease the grooves for that, bringing the shoulder blade around the rib cage. All right, for our last exercise, we're going to start to work on getting that upward rotation of the scapula. Okay, so the first couple exercises we worked on spine, getting some good flexion and extension of the spine. The second was we were then trying to work the shoulder blades or the scapulas around the rib cage to get some protraction and retraction going, greasing the grooves to allow that upward rotation to occur. So the third exercise is now we're going to start to target that upward rotation. One muscle that really helps with that is your serratus muscle, the one that really drives through, and you can see on your rib cage, it pulls your shoulder blade up. And then eventually we'll get our lower traps to tilt back. But we're going to work on taking our standing scapular retraction position exercise, and we're going to start to now work a new exercise that allows that upward rotation to occur. So once again, we want to keep our arms slightly outside of our shoulders, and we want to keep our center of mass through the middle of our body, so we don't want to lean forward. We also don't want to lean back. One thing to think about with this next exercise is if you start to feel impingement as we start to move through this, that's where your position to stop is. Once again, you don't want to move necessarily through some pain, maybe a little bit discomfort, but there's a difference in discomfort and pain, so really listen to your body. So from this position, all I'm going to start to do is walk my arms up and then bring him back down. So what's happening is, as my arms start to raise overhead, I'm going to have to start to fire that serratus muscle to rotate that shoulder blade down, or upwardly rotate that shoulder blade. So you see, this is very simple. Now as you start to raise, if you start to feel impingement here, then you may need to pull it down a little bit and just start there. Once again, we're working one of the more advanced movement portions of the shoulder blade, and if the setting position is not right, then you may start to get some rhythm. So you may have to pull back and just stay with our retractions and protractions. As that starts to get easier, then integrate this exercise into your routine. Now that's 3 exercises to do that can safely, in a sense, allow you to start working on your shoulder blades. Once again, it's always best to get a personal assessment done by someone that's qualified, but these exercises are geared towards the dynamic movements of the shoulder blade around the rib cage that can help you kind of grease the grooves a little bit and get a little bit more functionality and rhythm of your shoulder blade and your humerus moving forward.